Hi, this is Dr. Duncan Ferguson, and in this presentation, I'd like to talk about antacids and GI protectants. So let's start with this sort of almost overview slide, summary slide. It's a little complex, but again, I'll walk you through it. In pink, I want to have you note the uh, drug classes. The proton pump inhibitors that directly inhibit the hydrogen potassium ATPase, producing hydrochloric acid from pushing it from the GI gastric epithelium to the lumen. We have antimuscarinic drugs that work on this basolateral membrane muscarinic 3 receptor that normally, where acetylcholine is a neurotransmitter, stimulates inositol triphosphate and calcium, and then stimulates hydrogen and potassium ATPase. So antimuscarinics are antacids. We have histamine 2 antagonists. They work at the basolateral histamine 2 receptor, and these are basically because they work this way because histamine works through the adenylate cyclase pathways to stimulate hydrogen potassium ATPase. So blocking histamine at this receptor is an antacid effect. And then we have a drug that basically mimics a natural agent, prostaglandin E1 or E2, that act at the prostanoid receptor at the basolateral membrane. Normally, this will be inhibitory, so that's why they have the red effect, G inhibitory, adenylate cyclase effect that inhibits hydrogen potassium ATPase. So we give misoprostol orally to mimic situations where we have maybe a decline of prostaglandins due to, for instance, nonsteroidal anti-inflammatory drugs, and then these become basically antacids as well. So you can see, if you understand where these drugs work, you can understand how they might be complementary in some ways. So we have very potent, very clinically useful drugs, the proton pump inhibitors and histamine 2 antagonists. These are the most common ones you're going to see in practice. So let's talk about histamine 2 antagonists. The prototype for this class is cimetidine. It's been around a long time. And drug companies have evolved this class of drugs through creating longer acting drugs can be given less frequently. Ranitidine, which added on prokinetic activity, then famotidine, it's more potent, and nizatidine, which is also a prokinetic. Drugs are considered relatively safe, but they can have drug interactions that shouldn't be ignored. For instance, there can be a decreased absorption or effect of drugs that require a low gastric pH, such as ketoconazole or sucralfate. I'll talk about that later in the case of sucralfate. And cimetidine, which has an effect to alter the metabolism of other drugs like diazepam through its inhibition of the cytochrome P450 system. So while the class of drugs in general is safe, we need to pay attention to other drugs that we're giving to make sure that we don't have drug interactions. The proton pump inhibitors, PPIs sometimes called, antagonize the hydrogen potassium ATPase proton pump. If you recall the graphic I showed you, and these drugs work in an acid environment of the stomach, which is obviously what we're trying to inhibit. So obviously they work initially when they're protonated and then transform to an active inhibitor that inhibits the pump and therefore um, leads to blockade of the hydrogen potassium ATPase. It becomes inactivated. Um, the drug becomes inactivated or less active when the environment becomes less acidic. So it's almost a self-regulating situation. So these drugs have been shown to be very potent agents and are now dominating really the clinical use, at least in small animal medicine. So the classical example of the proton pump inhibitor is omeprazole. Its indications are stomach ulcers and intestinal ulcers, plus or minus. Obviously, it's mainly affecting acid secretion, so stomach ulcers. It can lead to changes in the GI flora, as you might expect with alteration of pH. There's a question as to whether it can be a prophylactic for ulcers, and the only data that's out there regarding this is that those animals that are placed, working dogs, for example, placed under stress, like Alaskan sled dogs, had less GI ulceration when gastroscoped uh, with omeprazole compared to famotidine. The question is open regarding whether hospitalized animals under stress or animals under given NSAIDs or glucocorticoids are equally well protected. But the assumption is, I think clinically already, the assumption is that many people believe that these are more potent agents for that scenario, even though the clinical evidence is yet to be produced. Now, the third class of drugs that I wanted to talk about, we use occasionally for particularly when we have suppression of um, the production of prostaglandins with gastric ulcers caused by nonsteroidal anti-inflammatory drugs. Basically, because prostaglandins are useful to increase gastric blood flow, they depress gastric acid secretion, they increase bicarb secretion and mucus production, and increased colonic motility. These top three effects are why we would use them for uh, a suppression, why we would want prostaglandins to be around to suppress acid secretion. So when we think that they're suppressed, we can use this drug orally. Misoprostol is a prostaglandin E1 analog. And so in an animal that's not vomiting, it's not cheap. It's not a cheap drug, but it can be used to help restore prostaglandin levels and effects in the stomach. The side effect can be diarrhea because prostaglandins are very potent muscle stimulants. And the final drug I wanted to talk about was sort of a special class in itself. It's called sucralfate. It's a drug that's given orally, can be activated in low pH situations, and it is stimulatory to prostaglandin secretion. Pepsin is inhibited and increases mucus production and bicarb, so all good things for an ulcer. And it also tends to bind to damaged epithelium, sometimes labeled the Band-Aid effect. And its indications include reflux esophagitis, gastric ulcers, intestinal ulcers, and possibly beneficial in as a prophylactic with nonsteroidal anti-inflammatory drugs, glucocorticoids, or hospitalized and stressed animals. Of course, you have to get this drug in orally. So again, as I mentioned before, not indicated for an animal that's vomiting.